Department of Health, we thrive on providing South Dakotans and the media the most updated COVID-19 information as it becomes available. To that end, here's the latest statewide COVID-19 information. New confirmed cases, 183. New probable cases, 80. Active infections, 1,891. Recovered cases, 108,053. Currently hospitalized, 102. Total tests performed, 959,404. Total unique persons tested, 419,827, with 111,808 positive cases and 308,019 negative persons. We continue using the RT-PCR positivity rate, since that's a measure being used by CDC, as well as CMS for nursing home and long-term care facilities reopening plans. That last 7-day number as of this morning stands at 8.4%. Additionally, 191,874 doses have been administered to 127,096 residents. As a reminder, this provisional data can be found on our updated COVID-19 dashboard, which is found at doh.sd.gov. And with that, I will now turn it over to our state epidemiologist, Dr. Joshua Clayton.
All right. Thank you, Daniel, for the updated numbers. So as we're continuing to monitor the number of cases in the state, we have seen just a small 2% increase from in the last week compared to the prior 7-day period. That does mean that we're still seeing about 1,100 cases per week. And so that individuals should continue to take precautions to avoid coming into contact with somebody infected with COVID-19. That includes making sure that you're staying at home if you're sick, first and foremost. Individuals should also avoid crowds and physically distance greater than 6 feet from other individuals. And when that's not fully possible to do so, please wear a mask. And then just adherence to cough etiquette and hand hygiene as well to make sure that we're not spreading COVID-19 as well as other respiratory pathogens. The dashboard update that we have for you today, have added some additional information to our vaccine tab. So if you navigate to the vaccine tab on the COVID-19 dashboard, the number with the blue background shows the percentage of the state population with at least one dose, and that number has been updated to include some of the aggregate information that we receive from on federal entities. So that includes our Veterans Affairs and our Indian Health Service. So below that blue box, you'll also be able to see specifically broken out the 1-dose and 2-dose coverage estimates, and that contain that aggregated federal data. We just wanted to point out that no other items on that vaccine dashboard include those federal doses. It's only that a small subsection on the upper right-hand side of the vaccine tab. And one last note regarding vaccination is that as of last Friday, February 19th, we had more than 8,400 doses that were administered to South Dakotans, and that includes first and second doses. And that's the highest number of doses that we have administered in the state. That we're receiving, as well as the great efforts by our Phase 1 vaccinators and federal pharmacy partners to make sure that we're getting doses to individuals. We also have, related to COVID-19, some of the monoclonal antibody treatments and therapies that are out there. So there have been released some national numbers to help identify what the impact of those therapies have been. Across the U.S., there have been a total of more than 40,000 of those monoclonal antibody treatments that have been provided. And it's estimated that for every 21 treatments, one hospitalization is prevented, and for every 52 treatments, it prevents one death. So we have estimated around just under 5,000 of those monoclonal antibody therapies have been provided specifically within South Dakota, and that has does mean that it translates to about 160 hospitalizations that have been prevented and 65 deaths that have been prevented using those calculations. As we do continue to work with our healthcare partners to make sure that the monoclonal antibody is available, and it is now readily available as part of their general suppliers and so on. So they're able to continue to provide those services to South Dakotans who are at highest risk and meet the requirements for that monoclonal antibody. The last thing I'll just want to mention, influenza case numbers. So not only have the strategies to decrease COVID-19 transmission been effective against COVID-19, but also have been reflected so far in our influenza case numbers as well. So we have seen a mild season so far. We typically do peak in February every year, but we can have seasons where we see peaks earlier and later, and so we still want to take precautions. But so far this season, we've seen 45 influenza cases, 7 hospitalizations, and 2 deaths due to influenza. This same time last year, we had already seen around 7,600 cases, 270 hospitalizations, and 12 deaths from influenza. So again, when I say it's a very mild season, it definitely has been atypical so far. And it is not too late to get vaccinated against influenza. It does take about 2 weeks to produce antibody, but that does mean that once you hit that 2-week mark after you're getting vaccinated, that you're protected against the circulating strains. Even though we're seeing limited numbers right now, that does not mean that we might not see some additional influenza as the season typically goes on through April. So with that, I will turn it over to Secretary of Health, Kim Malsom-Ryson.
Thank you, Dr. Clayton and Daniel. Good morning to everybody who's joining us. Thanks for being here. I'd like to talk a little bit more about vaccination and what we anticipate seeing here next week. And so we continue to make very good progress on our vaccination efforts. We've seen over 186,000 South Dakotans receiving a vaccine and over 62,800 people completing the 2-dose series. So we're really excited about that. In terms of the state's allocation, we know that next week's allocation of vaccines, again, this is just the state allocation, will increase to 18,830 first doses, and that's up from 17,660 first doses this week. So that's a difference of 1,170 additional doses. Now remember that this does not include the supply that's being distributed by the federal government, so that's through the federal retail pharmacy programs, Indian Health Services, the Veterans Administration, and now we will also be seeing one federally qualified health center getting a direct federal allocation starting next week. So when you take those numbers into consideration, we will be seeing even more vaccine become available next week. So given the increased access points, as we're seeing more opportunities for people to get vaccine, we started vaccinating individuals 65 and older this week, and that will continue through next week. In addition, our Phase 1 vaccinators will start setting appointments for the next group, which will be those with one condition as listed and linked to our plan. And so that is a bit of a change in that prior to this we were talking about 2 or more conditions, and we will be looking at individuals with one of the listed conditions to be in that next priority group. We anticipate that group vaccination will start no later than March 8th. And we're really excited about this because this really represents the progress that we're making through that 1D population, which you'll recall is quite large, and it'll include folks, with various conditions, including those that are pregnant, individuals with Down syndrome, cystic fibrosis, COPD, or other medical conditions where we know there's a higher risk of poor health outcomes if they contract COVID. So immediately following this briefing, everybody who registered will be getting the updated infographics for distribution in an updated timetable around our priority population. So thank you for helping us get the word out about this, and again, those tools will be on our website as well. We're also really urging South Dakotans to identify which group they are in by visiting our website and taking the necessary steps to register with their assigned county vaccinator. And so there's going to be more and more choices for people, but we want people to really think ahead, get registered, because then when it's their time, it's going to be easier for us to get them in and get their vaccines. The other announcement that I have is a bit of a change in terms of how we'll be scheduling media briefings moving forward. And so given the progress that we're making with vaccinations, the updated dashboard, and the informational tools that we've been releasing, starting in March, we're going to be going to bi-weekly media briefings. So that means for March, the briefing days will be March 3rd, March 17th, and March 31st, and we'll still do those at 11:30 a.m. Of course, we still remain available to anybody who has questions or, has any kind of inquiry, but we think that it's time to kind of reduce the schedule, and we are confident we will still meet your needs, and we'll schedule additional briefings as necessary. So with that concludes my update.
Thank you, Madam Secretary and Dr. Clayton. At this time, we will open the floor for any questions. If you would like to ask a question, please identify yourself, your media outlet, and then ask your question. Who would like to go first?
It's Ben Chase with the
DRG
Plainsman. Media
Group.
I heard Ben with the Plainsman.
Yes, Chairman Fraser opened up the Cheyenne tribe as far as their checkpoints this week. Just curious what that relationship has been like with the DOH and their vaccinations. I understand that they're doing theirs with, through the federal program, but how that relationship has been.
Thank you, Ben, for that. I'm actually really excited to report that IHS has started participating in one of our weekly calls where we really talk about how we're vaccinating people in South Dakota and trying to build those partnerships and leverage those partnerships to make sure that people have as many access points as possible. And so I think we've long enjoyed, good communications with that group, but really glad that they're, coming to the table, sharing information about vaccination efforts and looking to partner in communities where that makes sense. And so I'm hopeful to have more to report on that in the future, but IHS is at the table. We also still have weekly call opportunities with tribes to talk through all things COVID, including vaccination, and, wherever we can be of assistance, we want to offer that.
Okay, next question.
Jody Heemster, DRG Media Group here.
Go ahead, Jody.
For Dr. Clayton, going back to the influenza numbers, could it possibly be, or could they be slightly skewed because people coming in not feeling well were leaning towards COVID and testing and treating that way? Or are we keeping track of folks that have flu and COVID? Or how are those numbers getting compiled at this point?
Yeah, and that is a good question, because if you aren't testing for influenza, you're not going to find it. But what I can say is that a lot of the testing that we keep track of includes not only the PCR-based testing that's done at places like hospital laboratories, but also rapid antigen tests that are done in clinics and so on. All of the parts of that surveillance that we have done are showing decreasing return for individuals who are infected with influenza. The part of process that we have is to specifically make sure that we're identifying influenza when individuals are being tested for COVID, because some of those symptoms are exactly the same. is some of the specimens that we're testing at the public health laboratory are being tested for influenza as part of our surveillance program, and that process has not identified any additional influenza positive persons as well. So we are conducting surveillance. We are just not seeing a lot of influenza at this time.
Okay. Thank you. Next question.
Eric Mayer, Kellan News.
I heard Eric, Kellan News.
Thanks. Yeah, I believe I heard Dr. Clayton say a high mark for vaccine doses in one day has been 8,400. I was wondering, is there a daily benchmark we're trying to meet? And I guess, what does it say that we were able to get 8,400? That's almost nearly half the weekly allocation. Does that say we could handle more vaccine if we got it?
This is Secretary Malcolm-Rice, and I think to answer your last point, we could definitely handle more vaccine if we got it. We don't necessarily have a daily benchmark, but we do expect and monitor that doses are in arms within the week that we get the vaccines into the state. And of course, you know, we saw some delay with some weather-related issues here last week, and so we were ready as soon as we got it, and we got shots in arms.
Okay. Next question, please.
Deb, WNAX.
I heard Deb with Black Heroes Pioneer.
Yeah, my question is more philosophical, I guess, for Dr. Clayton and the Secretary. What does having the COVID vaccine mean to you, or mean to this state, or to everybody, I guess?
Well,
did you envision this? Sorry, did you envision this day even 3 months ago when we were in the throes of the numbers we had?
Well, this is Secretary Malcolm-Rice, and I mean, I'm just really optimistic that with vaccination we will get back to normal, and it might look different than what we saw before the pandemic in some minor ways, but functionally people will, you know, be able to be with their families, be with their loved ones, and vaccines are just really an effective strategy to get there. I'm also really encouraged by what we're seeing for people being willing to be vaccinated, and I think South Dakotans recognize their part to play in terms of getting us back to normal, and that's by vaccinating a large number of people.
And I would say, yeah, several months ago when we were experiencing the peak of COVID-19 cases in the state, you know, November was pretty dark in that respect, and I think that is the case for all of us. It was hard seeing the numbers that we were posting, what that meant for you know, individuals and families, and especially as some of those folks ended up in the hospital and may have gone on to die from COVID-19. What I do think, you know, on one side of it, the vaccination really has been a morale boost for a lot of those healthcare professionals that have worked very hard to safeguard the health of South Dakotans and throughout the pandemic, and you know, really is kind of on the practical side of the public health perspective is, you know, a really excellent tool to have in our toolbox as it comes to preventing disease. You know, we've talked about other prevention measures, and you know, people have been working to decrease their risk, but this is something that once you receive the vaccine, you know, it just adds that automatic layer of prevention that you don't have to do anything additional after you get vaccinated.
Okay. Next question,
Thank
please.
you.
Jeremy Fugleberg, Jonathan from the Argus Leader.
I believe there's another question out there, Jonathan, so can we go to the other question,
Jeremy.
please? Jeremy?
I haven't had a first one.
Oh, then we'll do Jeremy, then Jonathan.
Okay, that's fine. Okay, thanks. Yeah, real quick, just asking, if you're going to the single underlying condition, first just wanted to, you know, make sure that when that gets put out, we'll have a clear list of what those underlying conditions are, because I've had some questions from folks. And then as part of that, just we're talking obesity is one of those underlying conditions, correct?
Severe obesity is one of the underlying conditions for the state's plan.
Severe obesity versus obesity. Is that correct?
Correct. That's correct.
Okay, thanks.
And you will have a concrete list.
Okay. Now we'll go over to Jonathan.
Hey, thank you. I don't know if either one of you have insight on this, but over the summer, the hospitalization rate, I mean, people who were hospitalized for this disease was closer to 10%, and in the last several weeks we've been running at about 6%, so it's significantly lower than people who were testing positive were actually getting hospital care. Do either of you have any insight on why that's decreased?
Well, Jonathan, I would just offer one thing, kind of high level, and look to Josh to feather in, but certainly South Dakotan clinicians have really adopted the use of those monoclonal antibodies, and we are early adopters of that. And we are early adopters of that, particularly for our nursing home populations, and got, infusions happening in nursing homes to really get at, what are one of the most vulnerable populations first and foremost. And so I think that's definitely part of why we're seeing fewer hospitalizations.
And this is Dr. Clayton. I would also add that, as we are getting some of those higher risk groups that would end up, those higher risk groups vaccinated, that it does mean that those individuals are less likely, to first and foremost develop illness. And, if we do happen to see breakthrough illness, hospitalization and death are much reduced beyond that. And I can say that at this point, we've not seen any confirmed cases of breakthrough disease. We continue to monitor and investigate any potential cases that are identified. But I think that's a huge impact as well, is that some of those very vulnerable populations have been reduced.
Next question, please.
Yeah, this is Jerry at WNAX.
Go ahead, Jerry.
So, Dr. Clayton, earlier you said the infection rate was up 2% over last week. Obviously, you don't want to see that go up. Is there a number there that you would raise alarms, week to week, 5%, 8%, as you watch for that possible next surge?
I do think it's always good to keep our number decreasing of new cases that we're identifying. We have kind of, between last week and this week, seen a pause in that downward trend. And so we haven't yet again reached the levels that we were experiencing over the summer, where we were sub 100 cases per day. And I would, we continue to obviously monitor the situation to make sure that we're not seeing a rebound, in our infections, and need to redouble some of our efforts around communication. I do hope to see that next week that our numbers will decrease, and if they're not, I think hitting on some of those communication messages again, and just reminding people that COVID is still very present in the state, and that we have not, despite having vaccination available and a lot of vaccine in arms, and being kind of in that national leader for getting vaccine out to our population, that there's still a lot of precautions that people need to take as they go about their daily lives.
Next question, please. If we have no other questions, we would like to thank you for participating in today's conference call. If you have any additional questions, please email us at covidmedia@state.sd.